Welcome to Sleep Better TV. I'm Scott Drake. Recent studies have shown a dramatic increase in the incidence of ADHD diagnoses in children. As a matter of fact, in the last decade, it's grown by 25%. My guest is Dr. Catherine+McGregor, who practices dentistry in Lyndhurst, Ontario. Part of her practice area is also treating pediatric sleep disorders. Dr. McGregor, we've talked in the past about a possible relationship between a sleep disorder and an ADHD diagnosis. Can you talk about what exactly is ADHD?
Well, Scott, ADHD is an acronym for Attention Deficit Hyperactivity Disorder. And yes, I totally agree with your statement in the beginning that we're seeing a tremendous increase in the number of children that are, I feel uncomfortable saying that they've been diagnosed. In fact, they have been given the diagnosis. I tend to look at it as they're being possibly unfairly labeled as having ADHD. In some countries, other than Canada and the U.S., only a psychiatrist or a pediatrician is qualified to diagnose ADHD. In my field, I'm a little concerned that possibly in the school environment, teachers are a little concerned about a child's behavior, and family doctors now can easily, make that diagnosis without really any testing. It's a very subjective assessment, usually done by both the teacher starting the process, sometimes the parents, and then the medical person that the child is brought to.
Do you think that it's safe to say that diagnosis of ADHD in these cases, a lot of the times it's just sort of a catch-all for a bunch of different symptoms that may not be related?
That's what I fear, and it's quite a worry, because once a child has been labeled ADHD, they seem to be almost considered, social outcasts. Sometimes they're put into a category where their performance is expected to be lower. It actually can change their life. These are children that could do better if someone took the time to do a very thorough diagnosis. And if it is something that is sleep-related, that's easily corrected.
For those watching who may not be familiar with that type of relationship, again, we're talking about the relationship between a pediatric sleep disorder, which a lot of people think is only common in adults, but it does happen with children as well. How could that cause symptoms that someone might think would be ADHD?
Okay, well, Scott, if you and I are not sleeping properly, we'll typically be tired the next day. We'll have some daytime fatigue. We'll have trouble focusing, but it'll be mostly a sleepy type of feeling. When children do not sleep well, the reverse happens. They usually get more active, hence the hyperactivity part of the label, and they have a hard time sitting still, paying attention. They become disruptive. When I was a kid, the term for that was overtired. We know now that it's not normal for a child to snore, and that can be a sign that the child has an airway problem while they're sleeping, which can disrupt the quality of their sleep. If that child can't get into a proper and lengthy and restful period of sleep during the night, then the next day they're put into this cycle of, back into their environment at school, and they're just not able to function properly. But again, instead of appearing sleepy from the lack of sleep, they're wound up, and that's where their behavior can appear to be an issue.
And the causes of the airway problems, can be adenoids and tonsils and things like that. How, as a dentist, you're able probably to see these things, even quicker than most professionals. How do you treat them?
Well, first of all, we also want to be careful to make, a diagnosis and gather all the facts of what we can see. So, yes, definitely, oversized tonsils can be a factor. So can the adenoids. As dentists, we can't see the adenoids directly, but we can make a referral to an ear, nose, and throat person who actually has to scope them to see them. But even, Scott, just the craniofacial development of a child, typically if we're breathing properly, growing properly, our tongue helps our arches, our upper jaw and lower jaw to form properly. When a child isn't breathing properly, they can have some narrowness of their jaw, some crooked teeth. They can have a high palate. All those things can also kind of becomes a catch-22. Those kids aren't breathing properly, so they grow with kind of a crowded mouth. And then because of the crowded mouth and narrow arch and constricted airway, they don't breathe properly. So it just goes round and round, and they don't breathe properly, they don't sleep properly, they don't grow properly. So as a dentist, we are looking for those things right at the first time we see a child, because we're trying to do everything we can to let Mother Nature, be able to do what was intended for that child, to have good growth and development.
And in the last few seconds here, talk about, again, how a parent might identify symptoms that, could lead them to suspect that their child has a sleep-breathing disorder.
During the night, the parent might hear the child snoring, which I say is not normal. The child should be sleeping quietly. They might hear the child grinding their teeth. They might notice when they look at the child, they take a peek at the child during the night, that they're sleeping in an abnormal position where they extend their head to be able to open the airway. Just the child's behavior, if the child seems to be more irritable than usual, if the child doesn't seem to be happy at school, or if they're getting feedback from teachers that the child is disruptive or not paying attention, these are all little clues. As the parent hopefully helps to brush the child's teeth, they might notice some of the things we do, although of course they're not trained to look at everything. But even just the fact that the child might be gagging when they're trying to brush for them. A child that can't breathe properly often gags on simple things like a toothbrush in their mouth. Little things like that. Sometimes a higher incidence of ear infections, because the eustachian tube in the back of your throat that's meant to help drain is going to plug up more easily if things are narrow. The child might be a bedwetter even at age 8 or 9, and that's very related to the quality of sleep. When a child is sleeping properly, antidiuretic hormone, also known as vasopressin, is secreted, which helps all of us, even adults, not need to pee during the night. So a child that's not sleeping well, isn't producing that hormone, is more likely to be a bedwetter, and there's a high incidence of bedwetters now. As you can see, when you walk down some of the aisles of the grocery store or the supermarket, lots of diapers and lots of large sizes. That's a social stigma for these child too. Children usually in that age group, 8, 10, 12, are often having birthday parties, sleepovers, and these children are embarrassed to have anybody know that they wet the bed, that they wear a diaper to bed. So often, they decline the invitation, but they desperately want to go. So it's something we always are very happy about if we can help them with that.
Well, it sounds like there are a lot of problems that in many cases can have an underlying sleep problem. Well, Dr. McGregor, we appreciate you taking the time. I'm sure you're busy out there in Lyndhurst. Thank you again.
Thank you, Scott. It's been a pleasure.
Dr. Cathy McGregor practices dentistry, and she also treats sleep-breathing disorders in Lyndhurst, Ontario. This is Sleep Better TV.